8 things on care that you can do to prevent cerebrovascular accident, AVC. Regardless age or of family history, a stroke is not absolutely inevitable. There it is some ways to protect right from today. Age the face may susceptible, such as an if mama, father or other relative next have suffered a stroke. Not you can and years back and neither you can change your family history, but there is many other risk factors for stroke on care them you can controls with condition to you can recognize. Information means power, says Dr. Natalia Rost, lecturer in the neurology at the Harvard Medical School and associate director of the acute stroke service from within the Massachusetts General Hospital. If know that there is a particular risk factor care you sabotage the health and the predispose the risk may big for stroke, you can too some the measures that to veterans the effects of that risk. There it is some ways to you start of today to do you under control risks before like stroke have place. 1. Voltage blood may small. Blood big is a factor important, care grows by 2 or even from 4 or the risk of stroke if is not carried sub control. The tension blood big it is main cause of a stroke both in the case of women, how and all husbands, says Dr. Rost. Blood pressure monitoring and, if it is shy, the treatment it is probable the may high attitude on care women can adopt to health their cardiovascular. The objective to keep TENSION blood sub 120, maxim, with 80, minimum. All right net from diet the Theo lot 1,500 mg per day, approx half of teaspoon. Avoid fair RIC in the cholesterol, such as burgers, cheese fat and ice cream. Eating 4 to 5 jugs of fruits and vegetables in the everyday, bitwo, 3 times per week and some servings of whole grains and dairy with content reduced by fat per day. Make may more movement, the put in 30 off minute of activity in the everyday even Maria lot if eat possibility. Give up the smoking if you smoke. If is necessary, it blood pressure medication. 2. Weakens. Obesity, such as and the complications related to this, inclusive TENSION blood high and diabetes, grow CHANCES that to you have a stroke if you are overweight, weakens THE put in 5 kilograms, may thus reduces considerable the risk of having a stroke. The objective to keep the index oftable injury, IMC, the maxim 25. Limited or avoid fats fill and trans. Try to not eat may a lot of 1,500 to 2,000 calories in OZ, in the function by the index oftable injury and of the level your of activity. Increase activity physics on care you do it practicing activity such as walking, running, aerobics or tennis and enter these activity in the routine every day. 3. Make many exercises. Drills contribute to the loss of weight and falling blood pressure, but constitutes and a factor independent reducing the risk of stroke. A study from 2012 found that the women care they walked 3 hours a week posed a risk may MIC to make stroke, compared to the women who do not have made to stay. The objective make exercises of intensity moderate THE put in 30 minute, 5 days a week. Make a walk through surroundings in the every morning after breakfast. Initiated a fitness club with girlfriends. When make exercises, keep going until when begin to you breathe may hard, but yet you can speak, activity physics moderate. Go on LADDER and not by elevator, then when you can. If not eat 30 off minute consecutive to make exercises, shares thane the sessions of 10-15 minutes distributed throughout the ACH days. 4. BA alcohol with moderation. It is true. If consume alcohol with measure there is may few opportunities to you have a stroke, study esto miss that if bay glass off become per day, the risk can smaller, according to Dr. Rost. But if begin to bay my a lot off 2 glasses per day, the risk grows significant. The objective consume alcohol with moderation. BA and glass off become per day. Make from the wine and CHOIC effacing preferred because this contain resveratrol, care it is considered a factor of protection of the heart and the brain. Be careful the size glasses. Drink standard means and glass off become the 150 milliliters, mug of beer of 350 ml a glass off strength day 50 milliliters. 5. Baby aspirin. The study of reference All Women's Health Initiative have found that the women of over 65 years care I take many a baby aspirin a day ISI, thus reducing the risk of stroke. Aspirin contribute to the foreclosure training of clots of blood. The objective you're to take many a baby aspirin in the everyday, if it's good for KEEP, talk to the doctor. How do you achieve? May first talk to your doctor to ensure that aspirin is sure and right for KEEP. If eating disorder HAEMORHAGIC, it is possible to necessary to veterans gradually increase the dose to you avoid complete this regimen. 6. Treats fibrillation. Atrial fibrillation with manifest sub-form of beating irregular heartbeat care favors the formation of clots blood the heart level. These clots can then PASSENGER until to the brain, producing UN accident vascular ischemic. Atria grow risk of stroke approximately 5 times and must treat it with big careful, says Dr. Rost. The objective if suffer from fibrillation atrial treated problem. If eat symptoms such as palpitations of the heart or difficulty in the breath, go to the cardiologist for a consultation. It is possible to necessary to take anticoagulants such as O-dose big of aspirin or warfarin, thrombostop, to reduce the risk of stroke due fibrillation atrial. The doctors you before and directions looking this treatment. 7. Treats diabetes. Present of amounts big of sugar in the blood over time BAD the vessels of blood, by may probable clot formation in the inside them. The objective to AND do you under control the level of sugar from blood. Monitors AND level of sugar conform the indications received by doctor. It follows diet, make exercises and it shots in order to AND maintain level of sugar from blood in the recommended limits. 8. Give up the smoking. Smoking yes the formation of clots blood in the different ways, you unpleasing blood and increase the amount of plate filed on the arteries, together of the diet healthy and exercises regulate, the renounce the smoked ISA from the may strong change of the style of life care the before it helps to veterans significantly the risk of having a stroke, says Dr. Rost. The objective to fold the smoking. Ask your doctor for advice about your eyes that are made proper way to stop smoking. Used adjuvants for the renounce the smoked, like pills or patches with nicotine, counseling or medication. Not abandon. Most of them smokers I pass through some test unsuccessful before to give up. Musto take each test failed that being and not make close to becoming habit. Recognizes signs of stroke and ACTS immediate. Face, a part of the face you hang in the if when smile. Hands, if want to and pick up both hands, it's hard to make to stay with one from hands. Talk indistinctly or give strange. Time, if you notice any from these signs that you are to someone else sounds immediate, the 112. Other signs of stroke are weakness or part of the body numbness face, headache sting and severe loss of sight, numbness and tingling unsafe walk. Commencement treatment in the maximum 3 hours off the first symptoms of stroke and significantly influence healing compared to disability on life. Too many ladies ignore the signs of stroke because with asks if their symptoms are real. The recommendation thing it is do not wait if each either one from these symptoms unusual, recommend Dr. Rost. Women must ISI listen to your body and to with trust in their instincts. If something is noting the rule, ask immediate specialized help.